In general, the same way that you would get educated on anything related to efficacy. So it's, med ed kind of programs, and I think that when we go to ASCO and ESMO and those kinds of things, it has to be something and when we go to value-based conferences, it's something that, has to be there front and center. And obviously there are comparative studies that are being done, but the conversation has to continue to develop in terms of where do we, can we go with the data and apply it, and where do we stop? And I think that has to be an ongoing conversation. And ultimately, the decisions have to be made based on what are we doing that's best for our patients, that's best for society. Obviously, when we see a patient in front of us, we're thinking about that patient in front of us, and we're never going to veer from that. But as a system, both as a large practice or as a society in general, we have to think about it more holistically, and come up with the best game plan to give the best value without changing efficacy. So as long as there's no change in efficacy, if you can get by with the better value option, it makes sense.